call the August 3rd, 2020 Rockingham County School Board meeting to order. The first order of business is for us to approve the agenda for this evening. Can we have a motion for approval?
I move we approve the agenda as presented.
Thank you, Ms. Lord. Do we have a second?
Second.
Thank you, Dr. McQuilkin. Any questions or discussion, board members? Okay, seeing none, can you vote electronically? Okay, it's 4-0. Let's stand for a pledge of allegiance. Thank you. We'll take a moment of silence. Thank you. The next item on our agenda is public comments. We have one speaker signed up this evening, Tatiana Cartwell. Ms. Cartwell, if you wanted to come to the podium and speak? Yeah, or do you want to? No, typically we take public comments at this point.
I mean, I can do the online ones first.
If you want a few minutes, we have some comments that are online that need to be read, so we can do those first. Dr. Scheichel?
Yeah. So as in during previous meetings, we had an option to submit comments online. But before that, to Mr. Perkins, thanks for all the setup. I did receive a text message from David Birchfield just a minute ago saying there's no live feed yet, so you might want to check, make sure that it's, because I'm assuming that you used the persistent link that you had given me. Yeah. No, I see the feed, so it's there. Just saw myself repeat all that. There were five comments submitted this time. And so I will read those. The first one comes from A. Breeden. While I respect Dr. Scheichel's wish to be able to analyze the COVID data from the return of college students and FAIR to determine if there's a spike in the numbers, I would encourage the school board to maintain the August 31st start date and or consider announcing a completely virtual start to the school year for the following reasons. First, parents and caregivers need to make plans now. A virtual start feels inevitable right now, but no one can make any plans because things are still up in the air. We have a major childcare shortage, and that will be exacerbated by kicking the can down the road. Second, if teachers know now that there will be a virtual start, they can plan. Teachers need to get out of this limbo of not knowing how school will start. Making a decision now will allow teachers and families to wrap their heads around what school will look like. We can't transition our students or set them up for success if we don't know what the plan is going to be for what phase the school will be in. Third, announcing a completely virtual start does not mean that in-person school cannot start in the second quarter, second semester, or whenever the school board deems it safe to do face-to-face instruction. Other area school systems are meeting periodically to evaluate the safety of face-to-face instruction, and we can do the same thing here in Rockingham. Fourth, State and federal guidance indicates that IEPs will likely need to be amended or completely redone for all IEPs. Deciding now will allow IEP teams to reconvene and really think about what sort of services, goals, and accommodations are appropriate and necessary for students without having to rush everything through. Complete, well-thought-out plans will be necessary to provide FAPE, free and appropriate public education, and protect the school system from possible complaints in the future. The second comment was submitted by Alicia Sly. As a healthcare worker, I understand the need to protect our children and the teachers, but continuing to adjust the start time further into the school year is prolonging the inevitable. If there is worry that cases will continue to go up and that the children will not be able to attend in-person classes, then the decision should be made to do virtual learning for the first semester, like many other divisions have already done, instead of further delaying the start of the school year. Delaying the start of school by 3 weeks adds many days that the students will have to make up at some point in the school year, or add on to the end of the school year when many families have plans set for spring break, summer break, etc. Our family, personally, has decided to allow our child to attend in-person classes for structure and a better learning environment for our child with items taught by licensed personnel that have chosen teaching as their career. But instead of continuing to delay the school year, virtual learning for the first semester to see what happens with the virus may be the key until it is safe for our children to return to in-person classes. The next comment comes from Beth Davis. As an RCPS employee, a mother of school-aged children, and also a community member, I just want to say thank you for working so hard to make the decision of how to best educate our children this year. I appreciate the time, your energy, and the effort you have put forth gathering information to make a decision that most likely will be pleasing to some and upsetting to others. You are very much in our thoughts, conversations, and in our prayers. Thank you. And even if your decision isn't my best option, I'm thankful to work for Rockingham County, a division that continues to show us that it truly values our community of students and employees. The next comment is from Mary Sizik. I am a student and feel that we need to be in the classroom, though that may be a blended model. Last March, while we were doing virtual learning, I did the work, but did not learn anything. We all need that connection with school. Those who are afraid to go back do have the option to be online. We will have precautions to keep us safe, so I'm not in fear. Please let us just go back to school. The next comment is from Ann Shiflett. This year, instructional assistants will be working with pre-K, kindergarten, and first grade students in a classroom alone without the teacher present. The assistants will be following plans left by the teacher and working full days. Why are these assistants being made to perform the duties of a substitute teacher, but being paid less than a substitute teacher? And finally, Danielle Davis. Thank you for your hard work in attempting, let me resize that. Thank you for your hard work in attempting to find the best way to both care for and teach our children in this unprecedented and unpredictable time. I wanted to address how it will be handled in blended model school when a student is asked to isolate or quarantine when they or a parent has been diagnosed or exposed. If a parent had been diagnosed positive and the child is asked to wait the 2 weeks, and then on day 10, a teenage sibling is diagnosed, the child may again be asked to wait 2 weeks. Perhaps then the father gets a positive test 5 or 6 days later, so the 2 weeks begin again. This child could then get it themselves and need to wait 10 days. In this case, a child in a 4-person family could be out 5 to 6 weeks. How will that child be able to keep up with in-person instructions? Might I suggest a morning check-in or at the beginning of each core subject, a check-in about what will be covered. This could be beneficial to children who are homesick or isolating and miss the in-person instruction. This could also be beneficial for those who are doing their virtual day and perhaps had questions on what they should be doing at home. Thank you for considering this option. That was the last online comment submitted.
Thank you, Dr. Scheichel, for reading those online comments. Ms. Cartwell, did you want to address the board? This is time where you make comments to us about what your thoughts and feelings are.
Your plan is set up already. You have a plan to open school
a plan that, well, I'm gonna have Dr. Schleifer.
You have a plan right now.
There's a plan that the board approved previously, and so that's currently in effect, yes. Of course, on tonight's agenda, there is an agenda item that says that there's consideration of a change to that plan. So the plan, I will make a presentation tonight based on new information and then make a recommendation to the board, and then the board will take action whether to approve that change, to not approve that change, to change, what I recommend in some way. So that's the board's decision. But the public comment part of the agenda is not an exchange. It's not a question and answer session. It is simply an opportunity for the public, just like it was done online, to address the board. And the board typically does not respond. So this is simply a 3-minute time where you as an individual in the community can address the school board.
Well, I have a suggestion. Change a little bit the plan next time because it's difficult to make a comment because I don't know what the plan. And probably as you see, every comment saying that we need to open school as soon as possible. Just so many data sets that it's safe. And again, it's just difficult to argue about something that I even don't know what the plan is. The plan is understood when I spoke with one of the members of the school district is 10th of September, but then as I understood it's the point of discussion, and one of the points of the discussion is the GNU students. And when I asked, are you guys contacted GNU, did you ask what they've done, what they're going to do, or to prevent COVID spreading in the community? They said that you guys don't even relate to that, GNU. So how you can make a decision based on something that you don't even have ability to discuss with and see maybe it's not even a point to kind of prevent that in your plan. So, okay, another way. I called GNU and they said that they've done everything and they're going to do everything to prevent spreading of COVID. They have their policies, and if there will be cases of COVID rising, they're going to put students online. This is the first point. The second point, I don't see how this COVID can affect students of the school district because we don't have a public transportation that we share with students. Students have their own, like, football, like facilities where they have classes. They have swimming pools and like a soccer field that we're not sharing with them. We're not sharing with them public transportation. In Walmart and other stores, they require wearing masks. So I don't understand how it will affect us. So as I understood it, this is the main reason why you are postponing that school, right? So you're not answering the question for the right now. So, and all data that I checked online saying that it's safe, like for example, Central Shenandoah says kids 0 to 9 years old, it's only 80 cases, and 10 to 19, 161 cases. About Virginia, like total cases 93,000, but only hospitalized 8,000. So technically, some of them maybe not even real positive COVID tests that you probably base your decision. I'm not even sure like what you base the decision on. That's why I really would like to hear. And my proposition to maybe next time to change a little bit setup because like we have comments, we make a decision, and we kind of like don't even have opportunity to say a word, right? Like you make a decision, and it's not even in discussion anymore. No. Well, this is what it is. I just don't understand. You guys represent us like we are. As a like Rive School District, it's you are representing us and our interests. Everybody's saying please open schools, and you like making stuff up. Do not open schools. Like everybody's saying it's safe, and you making stuff. Do not open schools. So I want to
have anything that they want to say before the board this evening? Okay. We're going to move from public comments to board member highlights. Ms. Lowell?
I'm going to pass tonight. Thank you.
Mr. Breeden?
I'll pass as well.
Dr. McQuilkin?
I do have a highlight. On Wednesday of this week, or last week, at Broadway High School, there was a summer school graduation, and it was wonderful to see all those students who came before and received their diplomas. It was a happy, happy time for them. There were 42 graduates, and all 4 high school principals spoke. So it was a wonderful event. And I'd also like to thank the calls from the various people who have been reaching out to all of the school board members, whether it's by email or phone call or letter. We appreciate hearing from you. It's important for us to hear how you feel about the plans that are going on. Thank you.
Thank you,
Ms.
Dr.
Reed?
McQuilkin. Dr. Scheichel?
I was going to make the same comment about summer school graduation. That's always a highlight during the summer, and so that was, a really positive event for those families. And it was good to see everyone follow the guidelines for social distancing and face coverings.
Ms. Woodrum is here. Thank you. Thank you for hosting us again. We appreciate it. So, as always, it's always inviting to come in here. So thank you for doing that. And Mr. Perkins, thank you for doing all our technology for us. We appreciate that. Okay. We're going to move into action items. We have the minutes from the last meeting. I need a motion for approval.
I move that we approve the minutes as presented.
Thank you, Mr. Breeden. And a second? Second. Thank you, Ms. Lohr. Any questions or discussion regarding the minutes? Please vote. The vote is 4-0. Dr. Scheichel, the 2020-2021 calendar revision.
Dr. Shiflett presented that for information last time. Unfortunately, he's not able to be here tonight, and Dr. Alderfer will take that agenda item in his stead.
Vice Chair Reed, members of the board, Dr. Scheichel. As Dr. Scheichel had mentioned at the last meeting, Dr. Shiflett had shared with you information about a proposed change in the calendar, moving it back from August 31st to September 10th. This is a recommendation from the steering committee, the reopening steering committee. And we made this recommendation for a couple of reasons. One is we want to be sure that we're able to best evaluate the local trends in COVID spread, especially after the return of students to the local colleges and universities. We do recognize that we'll be having some number of students in our buildings at the beginning of the school year, and we want to be sure that we are fully prepared and have a good sense of what the risks and what the trends may be related to the spread of COVID. And secondly, and as importantly, I think, it gives additional time for our teachers and staff to get prepared. Whatever the final decision will be, and I know that's a part of the conversation you'll be having here tonight, there's going to be a tremendous, significant change in what our students and teachers are expected to do. And to give our staff extra time and support to be able to be fully prepared for whatever the blended version of school will look like, we feel is very important and going to be necessary to make this a successful start to the school year. So I'll be happy to answer questions you may have related to the proposed change in the calendar.
Board members, any questions for Dr. Aldifer or Dr. Scheichel? Okay. Dr. Scheichel?
Yep, so I do recommend approval of the calendar as presented. And again, I think it's also important to remember, as Dr. Shiflett said last time, as this calendar, it makes certain assumptions about second semester. And so we may bring this again depending on the health data, at that time for changes for second semester. So I do recommend approval of the calendar as presented.
Board members, you've heard the superintendent's recommendation. Do we have a motion?
I move that we accept the superintendent's recommendation.
Thank you, Mr. Breeden. Do we have a second?
Second.
Thank you, Dr. McClellan. Any additional questions?
Just for clarity, September 10th would be the start date.
Yes, that's correct.
Yeah, pretty etched in stone, borrowing some major calamity.
Yeah, so as you know, most school divisions in Virginia start after Labor Day. That's in fact, in Virginia code, the so-called, the rule about amusement parks, right? King's Dominion law that basically mandated that schools can only start before Labor Day if they apply for and are granted a waiver, so for a pre-Labor Day opening waiver. And the reason Rockingham County typically has that waiver is because of the weather in the winter that causes enough snow days every year that we need that pre-Labor Day opening to get the school year in, with the requirements of 180 school days or 990 instructional hours. And so in this case, you're actually opening after Labor Day, as many divisions do. And in the current environment, there's also, the option then to avoid snow days, for example, by using our distance learning model on those days. So we do have additional options where makeup days shouldn't be necessary like they usually are, at least not to the same extent. And so that's why we also, feel confident that our instructional time and our school days don't need to be extended past the original end date of the school year. I know Ms. Lohr asked a question about that last time. And so, again, that's, in fact, the September 10th opening wouldn't be unusual because, again, many school divisions open post-Labor Day. Although, recently there have been more changes in terms of kind of balanced schedules where some school divisions want to start earlier and get the semester finished by the winter holidays, just like colleges do. But so it's a mix now, but we feel confident that this can accomplish our instructional goals and also, accomplish the other goals that Dr. Aldifer has mentioned, and I'll talk a little bit about that in my presentation as well.
Any other questions, board members? Okay. We have a motion that's been seconded, and so we can vote electronically. The motion is 4-0. Thank you. Dr. Scheichel, revised return to school plan.
Vice Chair Reed, members of the board. As you know, many of the school divisions in Virginia and in other states as well, that have recently had approved a plan for in-person learning or blended learning, over the last few weeks have made some changes to those approaches. And in most cases, that's simply based on health data in the community. Virginia, for quite a while, was trending nicely at that reproduction rate below 1, so where one person who is infected passes that on average to less than one other person. So the disease would basically, fade away if it truly continued that way. Over the last few weeks, that's changed again. Virginia is above 1 in that, so the infections are spreading. And in other states, of course, it's much more dramatic. So Georgia, for example, they have lots of issues now, and many other states as well. And so those recommendations for opening schools for in-person learning recently have changed to some extent. And a lot has happened. As you know, our neighboring divisions, or the one we surround really, the city schools announced somewhat of a change. Many think Harrisonburg is going to a fully virtual opening. That's not actually what the city schools have decided. They, decide virtual opening plus identified students, and so the specific vulnerable populations that they're going to bring back. And so some people assumed, well, if the city does it, Rockingham County will do it. And so before I, give that presentation, I want to clear that up. I've done it, individually with some folks, and generally speaking, the city doesn't make decisions because we make that decision. And it's the same the other way around. So when a school division that you share some programs with, like Massanutten Technical Center, makes a change, you're certainly going to look at it and consider what the reasoning is, because there is somewhat of a shared space. And Dr. Richards, the superintendent in the city, and I talk frequently, more than once a week. And we look at new research together, and we participate in regional meetings and statewide meetings, and then talk about what's really of concern here. And so for some of the reasons that the city made a change, we are also considering a change, but it's not all the same, because obviously the population is different. It's a city versus, one of the largest counties in the state, so that obviously makes a difference, but the disease trends are different as well. And in fact, the city is currently doing a little bit better than the county in terms of the number of new cases, per day. And as part of this rethinking, Dr. Richards and I, decided together to convene a panel. I will talk about that in a little bit with medical experts. But we also participate in some of the efforts of the United Way. It's called Rally in the Valley, where with the three colleges, so JMU, EMU, and Bridgewater, that are all coming back at the same time, and with Centera, we're working on some public service announcements, because it's important to us, that we can get our students back to school as soon as possible, in person, a regular environment. Every educator wants that. We all know that there are huge benefits for students being in school, but there are also risks, right? And there are always risks, but there are risks that we have to evaluate. And so that's where the collaboration with the city comes in. But in the end, we decide based on our environment and our needs what, we want to do. And so, as I said in the last meeting, when we talked about the reopening plan, for us, it's always the most important question here. Can in-school education be provided while keeping students and staff safe? As you have all heard from public speakers, at past meetings, there's oftentimes that focus on how many children have died, how many children have, caught, the virus that causes COVID-19, and sometimes what's missing is the staff in the buildings. We have a large percentage of our staff in high-risk categories. Some additional staff members have family members that are in a high-risk category. And so you can't have school without staff, and so staff safety is one of the key factors that we also need to consider. And again, not just how many staff members may die, we have to look at the health effects. And those can be significant. In fact, there was a study done just recently on patients that recovered from COVID-19 at home with only mild symptoms or no symptoms, right? So they were asymptomatic. And so what they looked at 100 patients that had recovered like that and ran all kinds of medical tests and found that in 75 of the 100, heart damage was present that was permanent. And it was heart damage that normally you would only see in patients with who had had a heart attack, for example. And that's not, it wasn't severe for the short term. So that's why, those patients really didn't feel like they had an issue. But it certainly has long-term effects that we don't yet fully understand. And so 75 out of 100 is significant. And they looked at control groups, right, to make sure that that was the difference between the two groups, is that they had been infected by SARS-CoV-2, so that virus. And yeah, that's some of the information that makes you think twice and three times about, when we even talk about being safe, what that means. This virus, when we talk to medical professionals, is really unique in how many different organs it attacks, what the effects are. There are people who come to the hospital who should be in a coma, and they're talking on their cell phone because the body doesn't recognize that their oxygen saturation is so bad because they're infected with this virus. And then once they crash, they're on a ventilator. So it does things that people haven't seen before. And in fact, even in the disease spread, I talked to a pediatrician today, and he said, this is a really unusual virus. Now, again, that pediatrician said, early elementary schools, it's really important that the kids are in the building. And so we had a really good conversation. And as I said, when I presented this the first time, we are educators, so we can design learning spaces. We are not medical experts. And there's someone commented to me, stick with your education decisions. Who are these phantom experts you always speak of? And so they were real people, but we also look at all the information coming out of the larger organizations, right? CDC, VDH, the Department of Education, Academy of Pediatrics, that originally made some fairly general statement about kids needing to be in school, and they have now modified that significantly in terms of the mitigation strategies that they recommend, and also the World Health Organization. This is the same slide that I presented last time, and I think it's important too to understand that what we're asking the board to approve is that there is a phased plan, and that these are the three phases. So there's a phase where we would be in 100% distance learning. What would drive that is either governor's order or the local disease spread to be so significant that we can't keep schools open, right? Because it depends on a number of factors, whether it's even possible. For example, if tests take 10 days to 2 weeks, like they sometimes do now, you have an issue. If you have one person and you have to wait 2 weeks for the test results, the contact tracing becomes almost impossible. On the other extreme, of course, is what we all want, 100% in-person learning. Right? So that's a phase. And in between, we have a transition phase where there's a mix of in-person and distance learning. And in fact, nothing is going to change with this. These are still the three phases. But because of the new information that we've received, my recommendation is to change the setup that is in that phase. And in fact, I do think it's probably best for the board to approve this phased plan, right? These three phases. And as you know, we always have conversations when we make changes, but I don't think it's necessary to every time convene a school board meeting if we want to change one grade level. And so there's always consultation with the school board. And I think, again, as we move kids back into school, we can do that as long as this meets there's no policy, of course, on this. And so it's an approval of the idea of these phased approaches. And then we would have conversations, of course, with board members as we need to make adjustments and why that may be. But we may not always call a school board meeting if that's what the board desires. And of course, you can also say you want to approve the specifics, because what you'll see is there's some very specific pieces to this that I don't know need to be exactly at that minute of the day, for example, in a schedule. So I'll show you that. The phase is determined, said that last time too, current phase of the economy, so we can't jump ahead of what the Virginia phase is. Local disease spread, and that's really a tricky one because based on conversations I've had, it's not clear what that really is. Coordination with local health officials, and then availability of COVID-19 testing. One of the huge concerns right now, because you can't really open if you're not able to get test results. We are a unique environment with many people in enclosed spaces, and so testing and tracing and isolating is key. I showed this slide saying, one of the big differences when we hear about, look at the countries that reopen, and there are many countries that have reopened schools, and within 6 to 8 to 10 weeks or so, they managed to go from the first case to the peak, back down. and then are now at a slow and steady pace. Some are seeing increases again, but schools did open there. And on the right-hand side, you see the disease trend in the United States across the board. It's not specific to Rockingham County, because ours doesn't look like that. But one of the key pieces that we heard from medical professionals is the reason these countries opened successfully, one major reason, is that those kind of disease trends have a huge effect on your ability to test, to do contact tracing, and then to isolate. So if, for example, a country with the same population of Virginia has 100 cases a day, then they can, from those people, determine who they were in close contact with over the last few days, if the results are coming back right away. And then you can contact trace, isolate those that are now also positive, and the rest of the the rest of the country can go on with their lives. And so there are pieces to that that explain why these countries opened the way they did. And so here, we don't have that same picture. And so the large number of cases, even if it's not in Rockingham County, so even if those are in the Hampton Roads area, for example, in Virginia, that has a huge effect on our ability to get test results, because the tests are sent to a lab, and then that result comes back. And now, again, that sometimes can take 10 days, which makes that really difficult. And I talked to the Virginia Department of Health about their forecast. What is testing going to look like in a few weeks when we try to open schools again? And so that is one of the big differences. Now, there were also, as even in the spring, we always talked about how quickly we will find new information about this virus and about the resulting disease. And one of the key questions that I always asked was, where's the research on children spreading the disease? Because again, when you looked at other countries, in some schools opening had no impact. In the vast majority of schools opening had no impact on disease spread, but there were exceptions. Israel, for example. And in Israel, testing, tracing wasn't available to the same level. And so that was one of the places where the opening of schools did impact the spread of the disease. Now, what wasn't clear, because you heard this line, the kids don't get it, the kids don't spread it, that kids can get it was actually clear early on. And in fact, if you look at the New York Times article from just a few days ago, and this was reported in many other places as well, so this is not a New York Times twist on it. What the research found was that younger kids actually carry the virus to a much higher level in the upper respiratory tract and in their noses. So they found 10 times the amount of virus in the smallest kids than they did in adults. And now what they also clarified is that doesn't mean that the youngest kids are 10 times as infectious. But we clearly see an impact on kids, and they clearly carry it. With other infections like the flu, kids are the key vector of transmitting it, but that's not yet clear, right? At least not in that particular study. They just looked at the amount of virus that was there. But the CDC published a paper about, that's actually not coming out until October, but it's preprint, so for other researchers to look at, about a study in South Korea. Because again, everyone wants to know how kids potentially spread the disease. And so in South Korea, a country that did a really good job with testing, tracing, and isolating, and also early on had high number of tests that were simply given in the population, that were offered. You didn't have to have symptoms like you did here. And they looked at 5,000 cases of COVID-19 and 50,000 people who were basically in close contact with those 5,000 over that time period. And so what they found was that children, so they looked at families because they were in the middle of a lockdown, and not lockdown, but in terms of restrictions. And so they looked at families and looked at cases where children were the first one in the family to test positive. And then they looked at how many adults, as a result, not as a result because it's hard to determine causation, but later on developed the disease. And with adults, that's about 1 in 5. And so with the age group of 10 to 19, there's also 1 in 5. There's no difference between middle and high school students and adults. So not only can they get it, they can also spread it. And then they looked at children under 10, and they found a difference. And that was that while still spreading the disease, it's at a much lower rate. So in that study, they found that 120 adults would later on be positive if the first person in the family was a child under 10. But that's important, right? Because there's indication, and the CDC said that children do play a role in spreading the disease. The COVID spread in college settings. You know, as you already know, we have 3 universities, colleges returning all at the same time, pretty much. Bridgewater College, Eastern Mennonite University, and JMU. So more than 20,000 students. And that's in a community where 20,000 is a pretty big impact. And we know that based on what we see, you know, in terms of traffic patterns, in terms of restaurants, and all the life that happens in the community. And there were some studies done where they simulated what the impact is of colleges, especially in these rural communities where there's such a significant increase in population. And University of Pennsylvania did a study, partly done also at Cornell, and they simulated basically all the kids coming back, all the students coming back, and then not following the guidelines, not following the mitigation strategies. And within a semester, pretty much every student was infected. When they followed all the recommendations to a T, then it still spread a little bit because, you know, students interact in smaller groups, but they had about 60, 65, I believe, in that simulation. And what you don't know is how much students actually will adhere to that. So for example, we are, again, in a collaboration with JMU and EMU and Bridgewater and Centera and the city schools are working on public service announcements. You know, keep our kids safe too, not just yourself, but there's a community here. And, you know, we have students from those universities and colleges that student teach in our buildings. We can't just stop having student teachers in the long run because then there are no teachers, it's a requirement. And there's also, of course, lots of interaction at restaurants. You know, we're in the same community. We see students, we interact with students, and although they don't necessarily hang out with us, but they are in the same public space. And so what it will depend on is how much the students adhere to the mitigation strategies. So JMU will have their students sign a pledge that, for example, that they will participate in no off-campus social events. Right? So think about what the JMU environment typically looks like. And it's also important to know that according to some that have tracked the local disease numbers and also, you know, where JMU students are coming from, that between 25 and 30% or so of JMU students will come from designated hotspots, right? Either in Virginia or other states. And so you will have JMU students or, you know, EMU or Bridgewater come to the area infected. That's unavoidable in the current situation. What we don't know is whether they will then adhere to those guidelines. And experience from other universities over the summer has been mixed. Right? In some cases, students follow those rules, and in some others, they don't. And the impact on those communities is exactly like, you know, they simulated, is the disease just spreads quickly. And then the final piece that I wanted to talk about, transmission and infection among attendees of an overnight camp in Georgia. So that was in the news just a few days ago. And again, there has been this idea that the kids don't transmit the disease. Now, the median age, I believe, was 12 at that camp. There's hundreds of kids at an overnight camp. And while the adults were required to wear face coverings, the children were not. And overnight camp, so they slept in rooms with as many as 15 kids, lots of singing, and, you know, some of the activities that researchers have said can be problematic. And hundreds of kids tested positive as a result of it. And so we know kids can get it, right? Now, again, there are always limitations to, you know, some of that research. Some of the kids may have had it before they got there. Some may have been infected afterwards. We don't know whether it's the 5-year-olds that infected the others, whether it's the 16-year-olds. Based on other information, it's likely the older kids. Because despite the fact that kids have 10 times as much, younger kids have 10 times as much in their upper respiratory tract, there's also a significant difference in how much air a 5-year-old exhales, right, compared to an 18-year-old. And so it does spread, and it spread across the age groups. So these are all concerning trends, and again, they are answering some of the questions we had, and unfortunately, not the way we were hoping. Right? So the hope was that kids truly, just especially younger kids, just don't infect others. They are much less likely based on this to do so, but they do, and so that means mitigation strategies have to be considered, to prevent that. Now, I did say, again, last time and every chance I had, that we will follow expert advice. We will get advice from experts. And so, of course, we read the information from CDC and VDH at the weekly superintendent's briefings. There's information shared, but we had some specific questions. We had read a lot of the research reports, and I just, for example, wanted to know, how do you compare a country like Germany or France to the United States when in Germany schools were opened in the spring and there wasn't a rise in disease? What would explain that while Israel, for example, had increases in numbers when they opened schools? And that's not a question I can answer, right? For that, I need an epidemiologist, someone who studies this. And so I contacted the Virginia Department of Health. We've worked with the regional director, Dr. Cornegay, for a while. Lots of questions go to her, and I asked her for a meeting with at least one epidemiologist from her staff, and then we also wanted to involve other medical experts. And then I talked to Dr. Richards and said, hey, you want to organize this with me? He had some connections, for example, at Brown University, where there are researchers studying COVID-19 and the spread of that virus. And so the people that attended, our leadership team, people from Harrisonburg City Schools, and this was a Zoom meeting, as a conference call. The VDH regional director, epidemiologist from the Virginia Department of Health, and then also Virginia Department of Health COVID-19 regional containment advisor. Now, by training, she's also an epidemiologist, so clearly well versed in this topic. Then we also invited a local family practitioner and a local pediatrician. And it wasn't a committee that would get to vote on what we were going to do, right? It's advice. They could answer questions, they could give us some pointers, what, for example, should be the metrics that we look at. Because the 5% positivity rate, whether that's a good metric depends on how many tests you do. So if you only test those with symptoms, you're gonna have a really high positivity rate. The 5% comes into play when you have widespread community testing. So even the metrics, depend on the circumstances. And so that's also, important to know. And so we had an hour and a half or so of conversation. And in the end, I said, here is how the board has voted so far. What is it that you see? That's a concern. For example, early on, the recommendation was that face coverings should be worn when you can't maintain social distancing of at least 6 feet. When the American Academy of Pediatrics came out with their report, they said, well, really, 3 feet's probably okay, because that's what they did in other countries. And then there was a conversation back and forth about that, and VDH says that's not what they would recommend. But we looked at every little piece, every mitigation strategy. What's the impact of having rooms without a window you can open? What level air filtration do you need? How do we contact trace when tests take a long time? There are rapid tests that you have your result in 15 minutes. And some of those are available locally, but the issue with that is they have an 18% false negative rate. So if you get a positive result, you have, you've been infected. If you get a negative result, you don't really, well, chances are 80% that you don't have it, but still a 20% chance that you do have it. And so that's really difficult to use, for making decisions about 12,000 students when 20% of infections, could be there without being shown on the test. And so those were, some of the things that we talked about. There's also a dashboard that the Virginia Department of Health has available, where they look at different pieces, disease spread in the community, what the trend is, and then they basically can tell, is this a community that needs to be really careful? Should additional closures happen here? Or is this a community where the trends are going in the right direction? And so when you look at Harrisonburg City and Rockingham County, even though the county is kind of teetering on that hotspot line, city is doing slightly better now. They said, yeah, one of the concerns is that there's likely a significant undercount of those infected. And this actually was brought up by one of the local doctors who said that in their practice, they see a lot of parents who refuse to have their kids tested. And part of the reason is that some employers, at least that's the reason that I was given, some employers use a return to work rule of 2 negative tests within 24 hours. VDH recommends now that another option is used that we would use, which is number of days since the first symptom, because what they found out is that you can test positive 2 months later, even though they can't culture any live virus, but because of the remnants of the infection, the tests still show a positive result. So people get one positive result after another. And so families sometimes make the decision that because they know if the child tests positive, they likely have to stay home from work. They then are quarantined, and if they have to have 2 negative test results, that could be a while. That's it. They, count on the kids only getting mild symptoms and don't get tested. And so we're not really clear on the number of cases that we actually have, right? Rockingham County has about 80,000 residents, and if you look at, widespread testing and what the percent positivity rate is, it's not just the 800 we have, right? Because that's 1%. It's likely significantly higher. Because even in Rockingham County, when they did widespread community testing, where you could just drive up and get tested, that percentage was significantly more than that, 2, 3, 4 times. Even if you have like that nice 5% positivity rate, now that's a different number, right? You're talking 4,000, not 800. So there are likely individuals in the community that simply are asymptomatic or that simply are sitting it out because they don't have to go to the hospital. The additional concern, again, I talked about that earlier, 3 institutions of higher education coming, and at least 25% would be expected to be from hotspots in Virginia or other states. New knowledge about children's role in transmission. We talked about that at length. The Georgia event hadn't happened yet, or it wasn't publicized yet. And so then I asked VDH, I said, we are really seeing these long delays in getting the test results back. I need to know what you expect that to be 6 weeks from now. Because if we start school and all of a sudden you have someone with a symptom that could be COVID-19, we can't wait 2 weeks to know. Right? Do we immediately, as soon as someone coughs, isolate everyone they've been in contact with? Right? You can't do that. So if you have to wait for the test results, if that's 10 days or 2 weeks, now the contact tracing becomes almost undoable. And the regional director from VDH says, actually, it's going to get worse. As all the universities return, as lots of other things happen, the labs are going to be even more flooded with tests. And the wait times, at least she expects them to be longer than they are now. And some of the physicians I've talked to, say that you don't even need to test anymore, because once it's severe enough, you go to the hospital. But if you have to wait 10 days to 14 days for a test result, that's not good. Now, not all tests take that long, right? Many take 2, 3 days, but there are significant waits, right? And so that lack of timely testing is a huge factor. So the transition phase that we recommend as a result of that, and by the way, at the very end of that meeting, so with 5 health experts there in the meeting, I said, this is our plan. Phased opening, A-B schedule, 2 days a week. We're bringing basically all these kids in except the ones that choose to be home. And we have our staff. Let me know now if you're confident that that's a safe way for staff and students. And not one of the 5 said that they felt that way. Right? And so that matters, right? So when I talk about using expert advice, and then this is Virginia Department of Health staff as well, and then people aren't really confident in that, then I have to take that into consideration, of course. And so what we still recognize is that for the youngest children, it is critically important, and for some vulnerable populations as well, to have that face-to-face contact. It's difficult to teach reading in a Zoom session. And we already had offered the 100% distance learning option to families that wanted that. That would continue. Many have said, well, so why don't you bring everyone else back? Those who don't want to come back, they can just stay home. Well, if we want to be safe, then we'd have to offer that to our staff as well, right? And anyone who chooses to then not teach, you don't have staff, right? So it's not just about student safety. You have to make sure that teachers are protected and staff are protected. And so we have to take that into consideration. We will still allow students to choose the 100% distance learning option, regardless of what we may think is the other option for the other students. And then the in-person learning for pre-K through first would remain 4 days a week in the building, with Wednesday being the day for some work at home. But we would shift initially to distance learning for grades 2 through 12. So pre-K through first in the building, distance learning for grades 2 through 12. And then others select in-person programming. So it all depends, of course, whether, for example, we have a class that requires table saw. Not every student may have a table saw at home, right? So if there are classes that require specific in-person components, and now we have a significantly smaller student population in the building, your entrance procedures are different. There's not as much mingling. You have cohorts, smaller cohorts of students that basically come for that in-person activity, and that can even be split multiple ways in a class. So we can accommodate that. Massanutten Technical Center has a unique situation. Every classroom has an external door. And based on how it's set up for the different trades, they also have their own areas where students can change into their work clothes. The restrooms are different. And so there you're really talking about 10 students coming into that area, which is half the capacity, 10 to 12 maybe. And so they can go into that classroom, participate in their hands-on activity. They are highly committed to that learning environment. We can require them to wear face coverings all day long, except during designated break where they can actually just walk out of their classroom. Take a couple minutes where they're distanced further. Those are things that aren't possible in a regular school building. And so MTC, for example, we can accommodate, right? And so there are other areas where we want that in-person programming. So in this transition phase, 4 days a week, pre-K, kindergarten, and first, Wednesdays, the expectation would be up to 1 hour of schoolwork. And this is where, this comes from when I said earlier, approve the phases, but whether that's an hour and a half, we don't have to have a board vote every time if we, decide that we want to make a change in some of the setup. Grades 2 through 12, virtual only, 4 days a week, Monday, Tuesday, Thursday, Friday. And elementary grades 2 to 5, 2 hours would be direct instruction, so synchronous. A teacher would be in a Zoom session and the students can watch that. That would be scheduled from 9 to 11. For those who can, we would also record those sessions so that if a student needs to watch that later in the day, they can do that. We would also have teachers then available for individual and small group instruction between 12 and 3. That can be virtual, depending on the size of the group and the task. We can leave that up, to the specific circumstances. There could be some face-to-face interaction. Again, if you only bring 3 students into a room to work on a specific skill that can't be done remotely, then you have different options. And so, again, we recognize that face-to-face instruction is appropriate and necessary, but we want to make sure that we don't have as many students in the hallways, in the classrooms, and to really segment out those who have to be there. Then independent work up to 1 hour. And then on Wednesdays, asynchronous instruction. So that means it's not a Zoom session with the teacher. There would be some tasks that the students are given that they work on independently. In terms of specials, if students are at home, art, PE, music, of course it's going to look different, right? So we would work, on different ways to engage the students in those subjects, but be a little bit more of a limited capacity. In middle school, so grades 6 through 8, 3 hours of daily instruction, again, synchronous, 45 minutes per subject for those who can, and it would be recorded. And this would be a schedule, so we would have virtual office hours for teachers. They have the 4 blocks, there's a break, and again, at the end of the day, the availability for tutoring and office hours. Again, independent work up to 1 hour, as we usually have homework. And then again, asynchronous instruction on Wednesdays. And if there are, again, specific in-person, hands-on learning activities, they could be offered on a limited basis. High schools, 2.5 hours of direct synchronous instructions. So we're on a 4x4 block, so 2 subjects each day. And then again, tutoring, office hours, at the beginning and at the end of the day, where teachers can work with students individually, online, or again, in limited cases, that could be in person, especially where you have specific hands-on requirements. For a lot of career and technical credentials, there are specified numbers of hours that have to be completed in person. So that's one of the things that we would look at. And also asynchronous instruction for the periods that aren't meeting, and additional time, for specific classes, so advanced placement classes, for example, dual enrollment, honors classes. On Wednesdays, it would be asynchronous because, again, Wednesday is a day for teachers to offer some office hours, but also to collaborate and for professional development. Now, in the transition phase, in addition to pre-K, kindergarten, and first grade, we would look at some populations for in-person environments. This is no change from what we presented, at least the first 2, special education students if the IEP team recommends that. So again, there are changes to individualized education plans, and if that student needs to come to the building, then we would accommodate that. Same for some EL students. So it all depends on the level of help that someone needs, but those have specifically been identified by the Department of Education guidance as vulnerable populations that we should bring to the building if we can make that happen. With grades 2 through 12 being mostly virtual, we can consider space. For example, again, one of the concerns is interior rooms with no windows, or rooms where a window can't be opened and ventilation isn't sufficient. So we have more classrooms available, and so we can look at making sure that we choose the best environments for those classes. So again, that's work that we would certainly do to make sure that the mitigation strategies are a combination of the best strategies we have available. We also will consider, for example, students that are working significantly below grade level in reading and or math. So if you have a 5th grader who reads at a 2nd grade level, we may, again, to avoid that loss of additional time, we may bring that student to the building. Students without consistent internet access, of course, that's kind of a moving target, but there are some spots in Rockingham County where you simply don't have internet access. Now, many families, the students have been spending time with their friends, and they may work at another student's house, but we don't know for sure. So depending on the numbers, we are providing mobile hotspots to families who have that option but can't afford it. But in the few areas where you just can't get a signal at all, we would make accommodations there. And then other vulnerable populations, again, as needed. So we can be flexible there. It depends on how many students choose that option and what our layout is. And so, of course, we want to make sure that we accommodate students as that's possible. MTC in the transition phase, just like in the original presentation, would operate on that AB schedule, on that blended schedule. So again, it's its own environment in a way, and we had the conversation with Harrisonburg as well. And even with a September 10 start date, MTC would start on the 31st. It's the reverse of what it usually is. Usually we start first, the city starts later, but the city students still come to MTC. So This is just a reverse of that. The timeline, we would look at data trends all the time, daily. Beginning in October, so September 10th starting date. So 3 weeks in, we would start looking at what we've seen. Now you're 2 or 3 incubation periods into the results from students moving in, possibly the Rockingham County Fair. That's going on at a limited level. So we would see what the community spread looks like. We'll also see what testing is then, again, a couple weeks later. And based on that, we would look at, again, beginning with elementary students, now increasing the in-person options back to that blended model that we previously had talked about. So we would move from the virtual instruction to the blended model with A/B days. Middle schools, we would consider it at some point during the first semester. We would, again, start with elementary schools, and then we would look at, middle schools, are we now comfortable with middle school students? For high schools, because of how we will set it up in terms of the virtual environment and classes ending at semester time, that lends itself to simply have high school virtually, again, with the exception of some of those special populations, for the first semester. So we had talked previously about this home learning academy, and if we keep it separate, right, so you'd have a teacher teaching AP English in the home learning academy, then well, now the students are at home. If we bring them back halfway through the semester, now staffing all of a sudden has to change completely, right? And so we have much better options for students in terms of the classes they can take if all the students commit to that virtual or in the virtual environment through the semester. So, for example, if you have only one teacher that can teach, a particular subject, now with all the students being in that environment, that class is available to everyone. Right? Previously, that was going to create some issues. If Virtual Virginia wasn't available, and so on. So that actually helps with that as well. So the students can then, if the data indicate second semester, they could return. Now, all of that being said, of course, if for some reason there's a significant change in the health data, and we feel like we can make a change to normal school, certainly we would consider that. So it doesn't mean that if all of a sudden, something happens, and this is no longer a health threat, then certainly we would I'm not going to say, but we'll still stick, with the rest of the semester. So certainly options there. For classrooms, we said that last time, desks would be 6 feet apart so that we maintain social, physical distancing there. And we had a lot of conversations about the original CDC guidance that said it's important to have face coverings for students, especially when 6 feet can't be maintained. And over the course of the following weeks, with the American Academy of Pediatrics saying 3 feet, it seemed that all the guidelines that we got, 6 feet would be okay, right? Recently, there's been more of an issue with this fear that the virus spreads through aerosol, not just the droplets, and that could travel further, and that especially again in poorly ventilated rooms, that the virus could linger. And so teachers have said, if you look at what is most safe, that is face coverings all the time. That's also part of the governor's order, Executive Order 63, I believe, so indoor spaces. Although he issued a specific exception, to education at that time, but for all other indoor spaces, and now that we know about disease spread, it does make sense. And so we would require, as kids are in the building, mandatory face coverings. Now, what you have to focus on then is breaks that you give to remove those face coverings. So like I said at MTC, they can just walk out of that one classroom, distance 10 feet, whatever it is, and take the face coverings off for a while, right? There are options in school classrooms as well, sitting around the perimeter, facing inward. So the next person really, if you're looking straight ahead, is across the room. So you can work with kids. It's all an education process, as everything is. If families, make it a priority that the child gets used to face coverings, the children will do well. Dr. McQuilkin, I believe, visited some summer school classes, and what we hear from the principals, some students, they just are not used to that at all, and but with the proper training, education, the focus on that. You know, there are other schools where they were quite successful with that, and that's what we also hear from other environments. So it's just an additional protection. Again, the mask protects the other person. It's a little bit of protection for the wearer, but as you saw Anthony Fauci, we don't anticipate giving goggles to everyone, even though there was that was the conversation now, because it can, if someone sneezes straight at you, through your eyes, you certainly can also get infected. But we will more likely follow what healthcare providers do. And so for teachers, if they still feel like, they need additional protection, I will make face shields available. Again, they're see-through, so they don't affect, the visibility, and, the combination of a mask and a face shield, of course, is even better. And so it's about distancing, again, frequent hand-washing breaks, focusing on proper etiquette when you're sneezing or coughing. It's just important for those droplets when you do sneeze or cough, which is still the most likely way the disease spreads. Some, maybe others, like touching, contaminated surface, but the vast majority of people are infected through droplets, at least based on the numbers we see and what the researchers say. But there are other options, and there's no need to have a higher risk if we can avoid it. So we've talked about, the additional face shields. So for board action, again, I would recommend that the board approve the phased RCPS plan without, for example, class schedules, that we have either a 100% in-person phase, a 100% virtual phase, and a transition plan with select student groups in person. The decision would always be, we're not going to change from one day to the next, and without consultation. It will always involve the health data and how it's interpreted by the medical community, but also, of course, consultation with the school board. So, for example, in some school divisions, the plan is approved, and then the board may take a straw poll, where it's like, is everyone okay with this if we're making this change? If a board member objects, we can have that conversation. Do we schedule a board meeting to vote on the specifics? Or do we just bring, for example, second grade back? Should be second and third, right? Those are conversations. Why maybe second? Why maybe second and third? But I don't think it's beneficial at this point to say, here's the exact sequence. All that does is 2 weeks from now, 4 weeks from now, we'll be here again hearing about a change. I think the plan that's in front of you is how we intend to proceed. If, of course, the governor shuts down schools, we're in a different phase. If we find out more about disease spread and it's worse than we think, adjustments always have to be made. But this initial virtual opening for 2 through 12 with select populations in the buildings, we feel strikes a balance between the youngest children that needs that early reading instruction, for example, that need that time in the building, that we can accommodate that. And then for other students, rather than 2 days a week in the building, we keep them virtual and increase the number of students we bring to the building as the data allow us to. So that's what I recommend. And again, I'll make that recommendation here in a few minutes, but I certainly want to give the board the opportunity to ask questions.
Board members, you have questions for the superintendent?
First of all, Dr. Scheichel, I'd like to thank you for sharing this preliminary presentation with us, so we've had some time to look at it. I would like to, and I know that is your intent from talking with you, but I personally would like for the board to be connected to decisions that change this in a significant way. As the example you used was, if we bring back another grade level, I'd like to know what's going on there.
Absolutely. Again, if one of those, time slots changes by 5 minutes, we're not going to say, hey, are you okay with those 5 minutes, right? But we know, I think we all have a good sense of what is actually going to affect the daily operation of the building and the daily lives of the families. And if there's a change to that, we will make no such change without having a conversation The question is simply whether it needs to be, again, at the board meetings, because otherwise we'll have to just schedule board meetings, alert the media, and so on. It's just a different process, and absolutely that would happen.
So are you saying that there will be face coverings mandatory for all children, including pre-K?
So at the face coverings that, with elementary students, you have to be very careful, right? The recommendation is that no one under 2 wear a face covering, period. With elementary students, it depends on how feasible it is, right? So what happens in elementary school is, because of the definition of a face covering break, you're certainly going to do that more often. You're going to work with individual students. It's a different process. If a 17-year-old says, I'm not wearing a face covering, or takes it off, that's a different process than when it's a 5-year-old, right? And so we would still, of course, want to work with the family. We want to work with that student if there are specific needs. It's important to protect the other students, and it's also important to protect the staff. So you can consider additional mitigation strategies if there's truly a physical reason for a student not to be able to wear the face covering, and it's a student that we need to have in the building. And so there's some options, where instead of a face covering, you may be able to add a plexiglass shield. That's not as good, but it's better than not having it. You may have that student in a different spot in the classroom, right? Teachers know how to engage with a student that doesn't have that. So we want to be flexible, but I would say the expectation is that everyone wears their face covering. And we've seen it in summer school, we've seen it in daycare programs. It's an educational process, so we're not going to send a student home on the first day because they're pulling their mask down. It's a work in progress. And so this was, in part, a response to the 6-foot rule, right? So at the middle and high schools, we said, face coverings except when they're at their desk. And based on the feedback from our teachers, based on conversations with the medical experts, we said, let's eliminate that and say face coverings all the time. Ideally, we want to see face coverings on all the students. They, for example, can't be on a school bus without a face covering, right? So, yeah, you have the option of the parent or guardian bringing them to the building. And in the building, we have to make sure that we know what's developmentally possible, right? What's appropriate, is it feasible, and how can we accommodate if it's not possible, right? But it's certainly the goal and what we work toward, right? And so setting the expectation, if we just say, wear face covering if you can, then many just can't, right? If we say wear face covering and we work through it, there are adults too, who are anxious about it, right? It's not that they're not getting enough oxygen, right? It's that they're anxious about it because it's something on your face. And there can be life experiences, that impact that. And so, with staff members, you want to work on, start wearing face coverings, short periods of time and increase it. And so this isn't about, some punitive measure, but it should be the expectation that we put the mitigation strategy in place as it is possible, right? And so if someone can't, then still we want to get to a point where they can. But again, that's a collaborative work in progress. Right?
And we're also going to have face shields available to teachers.
Yes.
We have an ample supply, and we can make more.
Well,
right?
yeah, exactly. We used our 3D printers to print some components. MTC, in fact, has offered to produce some face shields. We're also ordering some. But not every teacher will want a face shield necessarily, right? It's a matter of combinations of mitigation strategies. So if I'm in a classroom where I can easily control how far away I am from students and I don't need to be close, right? And I have a window I can open, right? Again, we have to look at the impact on the HVAC system, but if you can have increased ventilation and it's a newer HVAC system where you can use a MERV 15 filter, then that's already taking care of a lot. We're also looking at some air purification options. You look at the distancing, and then you look at your face covering. In most instances, that's going to be perfectly okay, right? But if a teacher is in a high-risk category but wants to be with those students, or a teacher simply wants that additional protection, then it's got to be available. Right? But it's not a requirement for teachers.
Under what circumstances would we transition to full in-person learning sooner?
Yeah, so of course everyone is hoping that there is a successful phase 3 trial for a vaccine, and that it's widely available, and that everyone gets vaccinated. So, that would be one scenario, right? It could also be that we learned that the college communities really take their mitigation strategies seriously, and so we can transition maybe to the blended model sooner. But for in-person learning, there certainly would have to be a significant improvement in the data, but it would also require the availability of testing and contact tracing. So Virginia, announced that they would hire, I think, 1,000 contact tracers, but the contact tracers only are a third of the picture, because you have to have the tests. The tests have to come back in a reasonable time. You then can trace the contacts. So where someone was in close proximity, 15 minutes within 6 feet, and then you have to isolate. Right? And so it's a matter of people getting tested, of test results coming back, and then contact tracing and isolation working. Because again, that's how every place that has done this well, that's one of the key pieces.
You're asking for approval for a multi-purpose or a multi-phase plan. If passed, RCPS could quickly transition between phases. So how quickly should everyone, specifically parents, be prepared to transition?
Right, so we want to avoid saying, oh, look, the numbers were down this week. Let's bring these students back. Right? There needs to be some consistency. And that's one of the reasons why the plan calls for high school virtual programs, for example, to be for the semester. Right? I think the other direction where you become more restrictive, that can be on much shorter notice. If you remember, in March, we had called for an administrator meeting on a Friday afternoon to actually walk through the CDC guidance on when schools should be closed. And the moment we started that meeting at exactly that time, Governor Northam announced that schools would be closed, right? So Monday, kids weren't in school anymore, right? So it was like that. And so that can happen, but there's also different preparation now. Then it was you go from normal school to nothing, right? And it was emergency distance learning opportunities. That wasn't virtual learning. And so in that direction, it can change if there's really a spread that's quick, and if we find, increased hospitalizations and the like. In the other direction, we would certainly, again, we would start with elementary grades, and transportation has to, have the routes ready, which, of course, they work on that all along, but it has to be some time to ramp that up. And so I don't anticipate that we would say on a Friday, hey, Monday, second and third grade, you're in school, right? So we would, maybe a week, right, or two. That's a conversation that we would have. It impacts childcare providers. In that direction, of course, parents would feel, okay, now the schools are having the kids in the building. So certainly there has to be some time lag, between the decision being made, it being announced, everyone being able to prepare for it, and then starting that model. So be a week or two.
Thank you. I think that's all I have.
I'm going to assume, Dr. Scheichel, that every single student who is enrolled in Rockingham County Schools will receive an education.
Absolutely,
whether
right.
it's
So,
virtual or
the model is attempting to strike a good balance between health and safety and education needs. It is not ideal to have students simply learn virtually. If that was ideal, so we would do all the time. And so now it does work for some students, actually. Some online programs, that where students do that, because they work and they can take care of this in the evening, or some other reasons. But it's important for us to provide skills, content, the ability for students to work together in all these environments. So there still has to be a focus, which is why tools like Zoom, are helpful, where students still can collaborate. We purchased a license now as a division, and the type of license where a teacher can assign students then to subgroups, and so they would work in that group of 4 for the next half hour, and then you return to the full session, those kinds of opportunities. Compared to the blended plan, there's certainly also some advantages in this model, and that is that students would be, in that online environment in the synchronous class, every day or 4 days a week, and so 2 classes, at a time, and so they will have more contact. In fact, it's over a screen, but more contact where there's an interaction with the teacher, and so there are advantages of that too, but again, the change is due to the health and safety concerns for staff and for students. And it's always the assumption that, we provide really solid educational environments. And again, that's why the spring was so difficult for families, for teachers as well. The information from the Virginia Department of Education was, okay, we're just in crisis mode. We can't expect people to all of a sudden now have a completely different learning environment in place. And so we're just trying to provide continuity of opportunity in the learning environment. And so, you send things home and that can engage students potentially, but every parent, who then had to work through that, would tell us, that's number one, that's not an ideal environment. And number two, I'm not prepared for this. The pedagogy of, the skill level and pedagogy of our staff is significant. They are experts in providing those learning opportunities, and so this also provides that. Our teachers have time to prepare. There's lots of collaboration across the state, across the country, on providing that, and so it will be certainly an education environment that will be good for students. Right? It's different, and we are in a global pandemic that the likes of which none of us have ever seen, and so it's different. And all of us are looking forward to the day when we'll be back in school and the kids come off the bus and the hallways are crowded and it's a normal social interaction, because that's a significant reason for students to come to the building.
Dr. Scheichel, the one question I have that I know that we've heard feedback on is if we went to, let's say, an all virtual environment, our non-teaching staff, what that means for them. I know that some of them have been a little bit concerned about that.
Mm-hmm.
Obviously, with the model, the first transition that you're talking about, the phasing, there'll be more opportunities for them. And I think a few months ago when we started this discussion, we talked about how the job you're doing today may be a little different for tomorrow.
Yeah, and that's a conversation that's ongoing, right? I know, especially even with 2nd through 12th grade being virtual, with the exception of selected groups of students in the buildings. Now there's concern. What happens to staff that now doesn't work that way anymore? There are plenty of tasks that need to be completed. It may not be like you indicated. If someone worked as a classroom assistant and those students are now not in a classroom with elementary students, we need additional staff to provide, the physical distancing, so classes will be split in half. We don't have twice the number of teachers, so we find other ways, in parts that can be, staffing by assistants that work additional hours. It can also be staff from other buildings, for example. If we talk about specials, for example, there has to be a conversation. If we don't anticipate everything happening in the virtual environment, some of those teachers can work with the younger kids to provide some learning opportunities, to provide some experiences. And so it does require flexibility, but it also provides kind of that assurance that, our staff is valued, and we don't simply say, oh, with the virtual environment, now we're going to send 200 people home. There's a lot of work to be done. And again, now we're talking about a school environment where the students in the building are the vulnerable populations. There are lots of things we typically cannot get done despite our knowledge that it should be done. And so there will be opportunities, to provide additional assistance, to complete additional tasks, and it simply means that, someone's straightforward job description, might now move a little bit in that direction of, other duties as assigned. We need to work with folks who have particular ability to work with students, to do that, and even if that's not what they normally would do. And so we certainly have no intention of reducing staff, because they'll, again, number one, students will return as the situation improves. And number two, there are, even in that environment, a lot of things that need to be done because they need to be done differently. I hope that answers your question.
Yeah, it does. It
Job descriptions, they always have that famous line of other duties as assigned. We don't usually, we joke about it, so when Dr. Shiflett, goes through central office collecting trash the day before winter break, we joke about that. But in this case, it's simply we need to step up and provide the services that are needed.
Thank you.
Mhm.
Board members, any other questions? Thank you, Dr. Schultz.
So I do recommend that the board approve the revised RCPS return to school plan based on the information we received from local and regional medical experts. And again, what that plan means is that we have a plan with 3 phases that are adjusted based on, again, that type of information.
I move that we accept the superintendent's recommendation regarding the RCPS return to school plan as presented.
Do you have a second?
Second.
Thank you, Ms. Orr. Any other questions for Dr. Scheichel?
I would just like to make a comment and tell everybody that I appreciate their support. A lot of people have reached out and said you're not going to make everybody happy. And as the mother of 2 high school students, I can assure you this doesn't make me happy. So there's no way I'm going to make everybody happy. But we're in a pandemic, and I do feel like this is the best we can do. And I would like to thank Dr. Scheichel and his team for coming up with the best plan that we can at this point in time. So thank you.
Thank you. And it is a team effort. We spoke to that group of medical experts, and 2 days later spent 8 hours as a team working through the implications of what we learned. And so again, thanks goes to the entire team, Dr. Alderfer, Dr. Shiflett, and many others that are here and that are also in the buildings that provide us with feedback and contribute to these plans. So these aren't just made by a few people. They then get distributed. We get feedback from schools, discuss them in all the principals' meetings. So it's an extensive process, and again, I can only, because I have to go in and out of some of those meetings, as people call and media requests come in, and I have complete, faith that while I'm out of that room, these discussions are probably in many cases better than when I'm in there, because I've just taken down some rabbit hole, but these are always good conversations, and it is truly a team. We run these by board members at times, individually. There's a lot of conversation around, what's important for our kids, what's important for our staff, and how can we think differently to accomplish that under these circumstances. And, just like you said, we don't sit there and like, yay, we get to do virtual school, right? But it's one way to find that balance. So I appreciate your comment. And again, that thanks goes back to the entire team.
Anything else, board members?
I'm sure you're probably way ahead of me on this, but could we get those slides that show the changes posted on the website?
Absolutely, yeah. And so, of course, the presentation itself is recorded, so I'll work with Mr. Perkins to make the presentation available, and I'll also post the slides tomorrow. So, and we'll send out communication to the families.
So you'll send an email out?
Yeah, we'll send a mass email for staff also. I'll probably create a staff video to just introduce that, and we'll make that available to the community as well. And then the actual presentation, Dr. Birchfield, has created a separate page for our reopening plan, and so there'll be communication through that. And I'm actually meeting with him tomorrow afternoon as well to, formalize some of that. So yeah, there'll be communication going out.
Thank you, Dr. Scheckel. The motion's been moved and seconded. Please vote electronically. The motion carries 4-0. We're moving to information items, policy manual statement. Dr. Scheckel?
Yeah, as if you hadn't heard enough from me already, now I get to make a formal announcement. It's required per policy and BF Board Policy Manual. So here's the announcement. The School Board Policy Manual is posted on the Rockham County Public Schools webpage, accessible to employees and the public. Printed copies are available as needed to citizens who do not have online access. Further, changes in school board policy are presented at open school board meetings, predominantly as informational items to be approved at a later date. The school board welcomes input to the proposed revisions by school board members, administrators, teachers, parents, and other concerned citizens.
Thank you, Dr. Scheckel.
Be it so announced.
Thank you. So we'll move to school board questions. Dr. McCulkin.
Well, actually, I'd like to make a comment. And
Okay.
We are in uncharted waters, as you all know. We are in waters that have to do with safety foremost. And I believe that the plan that we have, which is always subject to adjustment as we learn more, I believe is at this time the best for our community.
Thank you, Dr. McCulkin. Ms. Lord?
Where are we at with our school lunch program and our Feeding the Children program?
Right, so I've spoken to Jerry Lehman about this. So again, we wanted to make sure that this plan was put in place. There's no need for him to redesign the approach until we know for sure. And so the school lunch program still, there will be a program, and it's just a matter of now designing it so that students who need access to meals have that. Again, likely similar to what we did in the spring, although it's going to operate differently. So we can't operate under the summer school feeding program guidelines where simply anyone in that age group could come to the building and receive meals. So that's to be a different process. But we certainly want to make sure that families that want to have that school lunch available can have access to it.
I'm sorry, I should have been more clear. The summer school lunch program, I've
Oh.
seen on Facebook that a couple of them last week was their last week.
Yeah, and so the participation in the programs, as expected, Mr. Lehman announced that really early on. He said there will be kind of that decline, as the summer progresses. And there are a number of reasons for that. One is that for families that qualify for free or reduced lunch, there are EBT cards that were distributed, from Richmond, so they're mailed out to those. We shared information, mailing addresses, and so there are options for people to use those cards to purchase groceries. So free and reduced lunch families now have that additional funding available where they can purchase groceries at the grocery store with those cards. Additionally, we're still working with Hope Distributed, so there's still a distribution of packets or boxes for multiple weeks to families that need those. And so that also explains then why families, especially in the summer, when most families are used to not participating in a school lunch program, now, have other options available. And again, there's additional help available. And so that's what we've seen. And so some programs just get consolidated, where you really, if you only have, 15 people show up at one school and there's another school as an option, then you consolidate. But the numbers just decreased. And so, yeah, there's also then that time to get ready for the new school year. And so this is, we've handled it that way in previous summers as well. So that ends, at a certain time so that we can start working on next steps.
Thank you.
Mr. Breeden?
Thank you, Ms. Reed. Sometimes when you have difficult decisions like this and weighty decisions like this, you feel like you're making them in a vacuum, particularly when one phone call says, you don't know what you're doing, why don't you send all the kids back to school? And the next phone call says, you don't know what you're doing, don't send anyone back to school. As some of you know, my wife is from northern Maine, and we have some friends there, one of whom is a superintendent of a small school division in northern Aroostook County, which is much more rural than Rockingham County. They have probably fewer than 2,000 students. And I was lamenting to my friend that weightiness of that decision, and I wanted to share with you their response. And again, this is a smaller school division than Rockingham County, more rural, with fewer COVID cases by far than Rockingham County has. My superintendent friend wrote back, I'm right there with you. After weeks of deliberating, we have decided to start school with the hybrid model. We have divided all students into two groups, either A or B. Group A students will come to school on Monday and Tuesday for face-to-face instruction. Then Wednesday, Thursday, and Friday it will be remote instruction for that group. No students or teachers in school on Wednesday, as we will do deep cleaning of the building. Group B will have remote instruction Monday, Tuesday, and Wednesday, then come into the classroom for face-to-face instruction on Thursday and Friday. This is not a perfect plan, but it's one that we feel we can keep small groups of our students and staff safe. Thought that had a little bit of a ring of what you have proposed, Dr. Scheichel. So all across this nation, in rural districts, even more rural than ours, with lower COVID cases, are making the same kind of difficult decisions.
Thank you, Mr. Breeden. Dr. Scheichel?
Yeah, to that point too, as board members, you receive a daily news brief in the morning where newspaper articles from across Virginia are basically summarized. And over the last 2 weeks, that's been the tenor. Changes to reopening plans based on, new developments in the disease spread. So the other comment I would want to make is, so for Ms. Cartwell, if you want to stay just for a minute as we go into closed meeting, maybe we can have a brief conversation about how we want to continue that conversation. So again, the public comments are set up a certain way, but that doesn't mean there can't be follow-up conversations about questions that families have. So maybe we can schedule something, but if you want to, we can briefly talk as we go into closed meeting. I don't have, there's, yeah, just to talk about how we want to continue the conversation, whether we want to schedule a meeting at my office or some other way. But I just wanted to let you know, so, because if you're leaving, then I'd have to, find out a phone number or some other way to contact you. So if you want to carry that conversation on in a different environment, that we meet in my office or somewhere else to talk about it and answer your questions, then we can do that. That's what I was just offering, for you to. That's correct.
Anything else, board members? Many thanks to all of you for being with us. We appreciate it. Staff trip home tonight. I know it's already dark. We have reason to go into closed meeting, so I need a motion for that.
I move that the board enter a closed meeting to discuss and consider the following pursuant to the provisions of Virginia Code, Section 2.2-3711A1, personnel, specific public officers, appointees, or employees for the purpose of considering such individuals' assignment, appointment, promotion, performance, salary, or resignation.
Thank you, Ms. Lord. Do we have a second?
Second.
Thank you, Mr. Breeden. Any questions or discussion? Please vote electronically. Okay, the vote is 4-0. We are now in closed meeting. Thank you.